Thiazolidione are a class of drugs that are used to treat type 2 diabetes mellitus by improving insulin sensitivity. They work by activating a type of nuclear receptor called PPAR-γ, which regulates the expression of genes involved in glucose and lipid metabolism. Thiazolidione bind to PPAR-γ, which forms a complex with another nuclear res, then binds to specific DNA sequences called PPAR response elements, which are located near the genes that are affected by PPAR-γ activation. The binding of PPAR-γ complex to DNA causes changes IPTOR called RXR. This complex then binds to specific DNA sequences called PPAR response elements, which are located near the genes that are affected by PPAR-γ activation. The binding of PPAR-γ-RXR complex to DNA causes changes in the transcription of these genes, either increasing or decreasing their expression. Some of the genes that are upregulated by PPAR-γ activation include those that encode for proteins that promote glucose uptake, storage, and utilization in adipose tissue, muscle, and liver. These proteins include GLUT4, adiponectin, and fatty acid transporters. By increasing the expression of these proteins, thiazolidine enhance the ability of these tissues to respond to insulin and lower the blood glucose levels. Some of the genes that are downregulated by PPAR-γ activation include those that encode for proteins that stimulate glucose production, release, and oxidation in the liver. These proteins include phosphoenol pyruvate, carboxygenase, glucose-6-phosphatase, and pyruvate dehydrogenase kinase. By decreasing the expression of these proteins, thiazolidine reduce the amount of glucose that is produced and released by the liver into the bloodstream. In addition to their effects on glucose metabolism, thiazolidine also have effects on lipid metabolism. They lower the levels of triglycerides and free fatty acids in the blood, which are associated with insulin resistance and cardiovascular risk. They also increase the levels of HDL cholesterol, which is considered to be beneficial for cardiovascular health. However, they also increase the levels of LDL cholesterol, which is considered to be harmful for cardiovascular health. The net effect of thiazolidine on cardiovascular outcomes is still controversial and under investigation. Thiazolidine also have anti-inflammatory effects, which may contribute to their beneficial effects on insulin sensitivity and cardiovascular health.